Hello, incoming graduate students. Welcome to your 2020 orientation. For those of you that cannot make it to campus right away, we are going to start out today with a welcome video from me. Then we will transition onto a video drone tour of the university. Next, we'll look at the calendar so I can brief you on important fall dates. Following that, I would like to introduce you to the team, give you a brief timeline of the program, and get into the part you're really interested in, the different tracks and concentrations available to you. Let's get started. We can find my intro video just inside the coffee cup. Greetings, incoming graduate students. My name is Dr. Terry Orsi. I am an assistant professor and the Graduate and CBURN Defense Director in the Department of Pharmacology and Toxicology. On behalf of the faculty, staff, and students at Wright State University, Boonshoft School of Medicine, I am here to officially welcome you to the program. COVID-19 has impacted the world, and this includes how we do orientation. Today, we're going to share with you an aerial view of the campus, the tracks, concentrations, and certificates the program currently offers. And as a special treat, a few of the faculty have created short videos telling you about the classes they teach and their research. If, at the end of this presentation, you still have questions, you need only email a member of the team. The drone tour is saved here in the cell phone. Now let's take a look at the journal inside for the calendar to look at some important fall dates. Important dates in August include the 24th, the first day of classes, and the 26th. That is the last day you can register for a class without a professor's signature. Keep in mind, it can be difficult to track them down, so if you need to register, you should do so before the 26th. Here we have some important dates in September. The first one is the 4th. That's the deadline to apply for graduation if you plan to graduate in December. On September 8th, you'll be charged a late fee of $100 per credit hour to register. And the last one for the month of September, the 18th. That is the last day you can drop a class without recourse. Sometimes you don't know if you're going to drop a class or not until you have your first test. So if you plan on withdrawing from the course after the 18th, you will receive a W on your transcripts. As you can see here in the October calendar. And November. Guys, you're going to love November. On the 11th, we have Veterans Day, no school. And then on the 25th, 26th, and 27th, we also do not have classes on those dates. thanks to Thanksgiving. Now, keep in mind that after the 24th, you will no longer have any in-classroom classes for fall semester. All of your finals will happen online. As you can see here, in December, your finals will be between the days of 7th and the 11th. And the 12th is graduation for your peers. Last day of classes is officially December 5th. Now, grades are due from us, your faculty, on the 16th by noon. So take a look that afternoon if you're interested in what your grades are. Now it's time for your PowerPoint presentation. Once again, welcome. It's time to virtually introduce you to some of our faculty. That's Dr. Jeffrey Travers, our chair, Dr. Alvarez Leafmans, Dr. G. Bill, she did a video for you, Dr. Young Feng Chan, Dr. David Kuhl, Dr. Mauricio DeFavio, Dr. Khalid Al-Assad, Dr. Sabir Hussain, he's usually at the base, Dr. Mike Kemp also did a video. That's me. Dr. Rohan, Dr. Rohan is our newest faculty member. Dr. Ravi Sahu did a video. Dr. Courtney Salentic, Dr. Yongji Zhu. These are our emeritus faculty. Dr. Lockwood, Dr. Adragna Lauf, Dr. Lauf, and Dr. Jim Lucat. Our adjunct faculty, Major Kelly Williams, Dr. Macropolis, Dr. Beal, and Dr. David Ellis. Now, these are some of your staff, Miss Catherine Winslow, Miss Corinne Thaxton, and Barbara Albright. She's our department admin, and Lois, our accountant. Thank you. Now let's move on to the team that helps put everything together for you. All right, we're going to start out with Dr. Jeffrey Travers. Now, he is the chair of the department. He's also a full professor, and he shares his time with us and the physicians building in the Dayton VA. He is a practicing dermatologist. That's me. I'm, of course, your director. I've been the director of the program since 2008. Miss Catherine Winslow, she is the assistant director, but she's also the assistant to the chair. So we could say she's maybe the most powerful person in the department. Keep that in mind. And then we have Corinne Thaxton. She is a program coordinator. She started with us back in February, right before the COVID happened. And Barbara Albright, our admin specialist. That's it. That's the team that helps put everything together for your programs. Okay, now I want to just briefly show you our timeline, let you get more familiar with our program and when it started. So first off, in 2001, the grad program was approved and we accepted 3 students. The courses were taught in the evening and the students did their research during the day. In 2009, a non-thesis track was approved. And that year we had our largest class, 30 students and 8 thesis and 12 non-thesis. In 2012, that was a difficult year. We transitioned from quarters to semesters and all of our classes had to be reconfigured. But we thought that wasn't enough work, so we created the CBURN, Defense Certificate Program. Now, the term CBURN, is chemical, biological, radiological, and nuclear. That may be new for some of you, but our department has actually been working in this field for several years. In fact, we had Sarah Nerve Agent housed in our department, and we were doing research related to the Gulf War. Now, in 2014, we rebranded our non-thesis track to truly represent what it was. It is a leader admin track. This allows students to take coursework that would prepare them for leadership and business positions in the sciences in and outside of academics. In 2015, Dr. Jeffrey Travers became our department chair, and he was our first medical doctor representing us. So we thought it was a good time to have a graduate degree geared specifically to the medical students at Boonshoft. That's the clinical investigation MD-MS concentration. We had 3 students start. We typically take 5 students a year. They all come from Boonshoft School of Medicine medical program. 2018, we started a 100% online track so we could reach students that had full-time jobs or other commitments. In 2019, we had to rework the MD-MS concentration because the medical school curriculum was changed. And in 2020, that's this fall, we started a new clinical trials coordination concentration. 3 years in the making. It is a track geared for healthcare professionals interested in clinical trials. Now it's time to look at our 4 tracks. We have 4 different tracks. The first one is the research track. In order to complete this, you have to be registered for a minimum of 5 semesters. The next 3 are leader admin tracks. The first one is a 4-semester cohort. The next one is a 2-semester cohort. And then the last one is an online track. This online track allows you to work at your own pace, and you can take as much time as you want as long as you're within the guidelines of the graduate school. Now let's look specifically at the research track. What you see on this slide is a program of study. The program of study lists all the courses you must take and when you take them. It also gives you a list of electives you can take. Now for this track, you only need 1. It also has signature spaces for your committee, your advisor, the chair, and the student, you. You'll want to meet with Miss Catherine Winslow regularly to make sure you are on track, with your program of study. And each research student is assigned a mentor, and you'll work closely with that mentor to make sure your research does not compete with your coursework. Courses specific to the research track include research techniques, thesis development workshop, introduction to research, and pharmacology research, either clinical or graduate. For research students, the option to take Six Sigma in place of statistics does not exist. As a research student, you must take statistics. Now let's look at the first of the 3 leader admin tracks. This is the 2-year track. You will look here, there is a lot of flexibility in your second year. Some classes you must take as a leader admin track student include Effective Science Writing Part 1 and 2, Lab Management. You may also take Six Sigma Green Belt in place of statistics. This is the program of study for the 1-year leader admin track. This track is intense. You must take on average 15 credit hours of coursework over 2 semesters. That's 15 each semester. While it may seem difficult, we do have many students complete this track in 2 semesters. Sometimes students want to take additional courses, they want to get some certificates, so they prefer to do the 2-year track, but it is not necessary. And here we have the program of study for the online track. If you do decide to do the online track, it's best that you let us know at the beginning of the program. There are some courses only available for online track students. Now, because of the pandemic, things are a little blurry, but don't worry, we'll keep you up to date on what courses are available. Now, as I mentioned, COVID has changed the way we do things, and what you see in front of you now are 2 programs of study designed specifically for spring 2021 only. And that includes, let's look in closer here, some of the classes that are offered this spring are offered only this spring because you could not take them in fall semester. So this is going to accommodate the students that wanted to start in the fall, but they have to start in the spring because they cannot get visas or for whatever reason. So we've created 2 programs of study. One is a research track and one is a leader admin track. The leader admin track does fit for both the online and the 1- and 2-year options. All right, before we get started on the concentrations, I want to give you this brief rundown comparing the tracks in case you're still not sure which one you're interested in. Let's start with the first line. Research track requires 5 semesters minimum, whereas the leader admin track can be finished in 2 semesters minimum. Line 2, you'll see that both are the same regardless of the track you take. Your degree will say received a Master of Science in Pharmacology and Toxicology. It does not say research track, nor will it say leader admin track. Line 3, research students are expected to be in the laboratory starting at 9 a.m. to 5 p.m. Monday through Friday minimum. Now, in some cases, you will be expected to work later, sometimes weekends. It depends on your experiments, your advisor, and so you should choose wisely. Now, I know working long hours can be difficult for some of you. You have family members, children relying on you, spouses relying on you, and some of you have jobs. So if you want to go the thesis route, you need to make sure that you choose a laboratory with an advisor that can work around or work with you on your schedule. Now, leader admin track students, you have the option to work in a laboratory, and how much time you will spend in there will depend on you and your advisor. However, most of the leader admin track students only show up on campus when they have class or seminars. Seminars are mandatory for everyone, faculty too. In case it's not clear, students in the research track must complete a thesis and defend it as part of their degree, and leader admin track students must complete a publishable review paper. Now, this is done over the course of 2 semesters with a professor/advisor. Line 5, research students work with the faculty member on a research project, and that project is determined by the faculty advisor, not the student. One of the other differences between the 2 tracks is the number of electives. The research track students spend their second year doing research in a lab, whereas the leader admin track students have, as I mentioned before, some flexibility, so they can do some department certificates, graduate certificates, and or national certificates, depending on the courses they take. All right, now let's look at the concentrations. The difference between the track and concentrations is that concentrations do show up in your transcripts, tracks do not. And as I said, we have 2 of them. One is clinical investigation. This is for medical students in Boonshoft School of Medicine. They spend 4 years getting their graduate degree while also working on a medical degree. They do the research in the Pharmacology Translational Unit with Dr. Travers, Dr. Rohan. The other concentration is the clinical trials concentration. That's the new one I mentioned earlier. And this is the program of study for both of them. Program of study for the clinical investigation. We'll look in closer just so you get an idea. You can see it's very similar to the leader admin track students, with the exception that they get to count 4 credits in exchange for all of their medical curriculum. This is the clinical trials coordination track. This track took us 3 years to get approval, and to determine coursework, we brought in a dean of a nursing college, a clinical trials coordinator, and some other experts. This concentration prepares a student to take the national test to become a clinical trials coordinator. And as I mentioned, we are only taking 5 students. You'll see that some of the courses are very similar to the leader admin track. Some big differences include the Intro to Cell Biology and Intro to Pharmacology are in place of biokinetics, biodynamics, and cell tox. They do take Effective Science Writing 1 and 2, as well as lab management. Like the leader admin track, they must take a Human Studies research class. I teach that, by the way, which is an elective for other students, and the Clinical Roles and Responsibilities class I do not teach. The students do clinical research over at the Pharmacology Translational Unit in the Physicians Building, which is on campus, but away from the main part of the campus, with Dr. Travers and Dr. Rohan. All right. Electives. We have quite a few electives, as you can see. Here we've highlighted courses that you can take and receive a certificate. Now, what that certificate means depends on the class. We have department certificates. That would be the leadership theory and application, one of my classes. Good laboratory practices. The person that teaches that is the branch chief scientist at the Navy medical unit over at the base. And boy, that was a mouthful, wasn't it? And then the Human Studies Research class. Now, within the Human Studies Research class, as you will learn later when you listen to me talk about that class, they do get national certifications through taking this course, 5 of them. Now, then we have the Six Sigma Green Belt and Black Belt. Those are national certifications. We brought in a Master Six Sigma person who teaches this class. She's been doing it for several years. We've had students get jobs simply because they had this on their transcripts. So these classes are really important, and it's why we allow the leader admin track students to take Six Sigma Green Belt in place of statistics. And then we have the CBURN certificate. You must take all 3 of these courses to get your graduate certificate, and it does show up on your transcripts. Okay, so hopefully I've got you a little excited. We're gonna now, let me just look down here a little closer and tell you more about the CBURN program here on this clipboard. There we go. So this is just giving you an idea of those 3 classes I mentioned. We do offer a special reduced tuition rate. We had interest from a couple select government agencies wanting to send their agents through our program, so we have a special rate for them. And because of this, you never know if you're in class with, for example, a military captain from Toronto, Canada, or a special agent working in the United States. Also, because of the sensitivity of their careers, you will not find those students listed on the Where Are They Now board, which is on a wall in the department. Okay, you guys ready? I know we've went through this very fast. You're going to be able to ask me questions whenever you need to. Right now, we're just going to focus on getting you registered and finding out how you can access those classes. So I'm going to take you through another video. Here it is. And it includes Wings and Pilot. You need to access Wings to register for classes, and you need to access Pilot once you are registered for classes to find out, especially if the classes are online, what you need to do. So I have this video down here. Now you may have noticed that Wings, Pilot, there's a theme there, and that is because Wright State was named after the Wright brothers, 2 Daytonians that founded flight, and as was Wright-Patterson Air Force Base next door. Now, we are all very proud of the fact that these 2 gentlemen, entrepreneurial freethinkers, gave us our name and our legacy. But you may be surprised to find out there are a few famous people affiliated with Wright State University, like actor Tom Hanks. He spoke at our graduation earlier this year, and he has a building named after him. There are plenty more, but it's not the time right now, so we're going to get started on this video. And here you go. There is no sound. I'm going to tell you what I'm doing. So we're on the Wright State's homepage. Pilot, Wings, they're listed there, as you can see. Calendar. Those important dates I gave you earlier, they came from that calendar. So clicked on Pilot. So I'm going to put in my username and password. There they are, signing on. 2-factor authentication. And like magic, very long magic, we're there. Now, we're in Wings. So you can access Pilot, Wings Express. You can see here there's a lot of information about courses. Add drop classes on the right. Get your grades. You could order your books for classes. There's a variety of things that happen on this page, but we're going to take it to Pilot, and wow, that was fast. Okay, this is Pilot. Now, this is my account, so it's going to look different from what you're going to see. Simply because I have more classes, hopefully, than you will. But now looking at 2020 fall, it hasn't started yet, so all the classes are inactive. But these are the classes that I am somehow responsible for. I don't teach them all, but I'm there. And you will only have the classes that you teach. So this just shows you how you can see your courses. if you have any alerts, you'll see that little orange circle next to the bell. And then if you're confused on what to do, you can also go to the libraries through here. You can get tech support. You can watch videos and other tutorials. And that's called Pilot. And that's it. Okay, now, before we get on to the faculty videos, I want to invite you to follow us on our department Facebook page. Let me pull this up. All right. The department Facebook page, the Graduate Student Medical Research Club. Yes, you heard me right. We have a medical research club for our students, and I happen to be the faculty advisor for this club, so I know quite a bit about it. Our students are the officers in the club, but students outside of pharmacology and toxicology are members. Last year, the students went to Charles Rivers Labs and did a tour. They went to Eli Lilly in Indianapolis, and they had plans to do a blood drive with the Red Cross in April, but that was canceled due to COVID. The other Facebook page we have is the CBURN Facebook page, and if you have time, and if you're a Facebook user, please take a minute or two to check out these pages. Look at some videos, get to know some of the past students, ask questions. The department has 4,000 likes, actually a little bit more than that. The CBURN page has over 1,000 likes. Now, the videos, I added music to them, and the music is a bit loud. So first off, apologies for that. You can find these videos and more. More faculty will be giving me videos, and I will post them onto Facebook, or Miss Corinne will post them onto Facebook. So continue before we start classes to go back to our Facebook department page and watch some of the videos. That will help you get to know the people teaching your classes, the information about the classes, as well as the research they're doing. All right, now it's time to watch the faculty videos. Let me just click over here. Now, the first one we have is Dr. Mike Kemp, and then to the right we have Dr. G. Bill. She's going to be talking about her classes. In the lower left we have Dr. David Ellis. He's one of our adjunct faculty, and then the black screen you see there is going to be Dr. Beal also talking about her research specifically. And then we have a couple more videos on the next page, but I'm not going to ruin it for you. Let's get started with Mike Kemp. Again, the music is a little loud, but you can find these videos on our Facebook page, and you'll have a little bit more control over them. Thank you.
Hi, my name is Michael Kemp. I'm an assistant professor here in the Pharm Tox department at Wright State. So I thought I would share a little bit about what I do here. My research interests are in the area of DNA damage and DNA repair, and specifically something we refer to as bulky DNA adducts. A classical example of this is UV wavelengths of sunlight, which can induce thymine dimers in our DNA. We know that these can be mutagenic and lead to things like skin cancer. However, we're exposed to a number of other compounds and carcinogens in the environment and in our diets that also generate bulky DNA adducts that can lead to a wide variety of other types of cancers. So we often think of DNA damage in negative terms. However, we often use DNA damaging agents, such as a classical example is cisplatin, generates adducts on DNA that can help kill cancer cells. And so DNA damage can both cause disease and be used to treat human disease. So in my lab, we're interested in something known as the cellular DNA damage response. We approach this issue, this field, in two main areas. One is, again, coming back to UV light in human skin. And our interests are specifically in developing new and better methods for measuring the DNA damage response in human skin, then to apply these for specific purposes and in specific patient populations. And one of the major projects currently being looked at in the lab is comparing the DNA damage response in young adult skin versus geriatric skin. Since we know older individuals are at higher risk of skin cancer, is this due to abnormal DNA damage responses? A second major focus in the lab is on cancer chemotherapeutics. And in this topic, one of our major interests is in a protein kinase known as ATR that is known to be a global regulator of the DNA damage response in both normal and cancer cells. So we're trying to understand what ATR function is in that context. A more recent project is to look at using drugs that can manipulate and modulate the body's circadian clock to potentially improve the effectiveness and limit the toxicity of DNA-damaging anti-cancer drugs. And both of these projects are currently funded by the NIH and the Ohio Cancer Research Associates. So we use a variety of experimental systems in the lab, ranging from in vitro protein biochemistry to quite a bit of human cell culture. Then we also use actually discarded human abdominoplasty skin for a number of types of studies. And when appropriate, we use mouse models. And then we also use human subjects research. And so we will often or occasionally take skin punch biopsies from defined populations of people for our work. My laboratory is located in the Biological Sciences building. I have a number of researchers actively working currently. We have one postdoc, one PhD student, and then currently 3 students in the PharmTox Master's program doing their thesis work. I also do some teaching for the department. In the fall semester, I teach a 1 credit hour career planning course where we look at the different types of opportunities that are available for people in this field, and then work to help students try to identify ways to potentially reach that next step once they're done here at Wright State. In the spring, I teach a course entitled Pharmacology Toxicology of DNA-damaging agents. Again, this is really focused sort of on my background, research background, and my interests. And this course looks at the wide variety of DNA-damaging agents we're exposed to, their impacts on cells, how cells respond, and then how these compounds can potentially impact human disease and treatment. With that, my contact information is listed here. I'd be happy to meet one-on-one with people and to discuss my interests and
So hi, this is Dr. Pierre from Pharmacology. I'm an assistant professor in the department, and I have been in the department for over 10 years. So today I'm going to introduce the courses I'm teaching. And the first one is the cell culture training. This is class combines in-class and online trainings, which will give the student the principle and the theory of the cell culture. So in this class, first we will have the online section to provide all the reading materials to the student, so the student can get a knowledge about what is the cell culture, what is cells. And then we also have a one-day workshop, which will have a lot of hands-on experience to work with the cells. And you can look at the cells under the microscope, and you can also to see or make mediums and change mediums of the cells, and sowing cells, and also freezing cells, and split cells from the 1 plate into 2 or 3 plates. So as you know, cell culture is a very widely used technique for almost all the lab. So I think by knowing these techniques can provide you more opportunity to find a job in the future. And the second class is a very interesting and exciting class. It's about animals. Usually it's in the summer. So the name of this class is Integrated Pharmacology and Toxicology. We have several instructions in this class, which will provide the expertise in different areas, including the basic handling, care, and usage of animals, and also the drug dosing and the administration to the animals, and also the animal models for the vascular and the metabolic disease, and also animal model for the tumor and the skin disease. So in this class, we also first have the lectures in the classroom, and give you the whole idea of about the animal handling care, and also the ethics of the animal. And then you will have a lot of hands-on experience with animals, and you can go down to also demo the surgeries, all different surgeries for making the cardiovascular and cerebrovascular disease animal model. After demo, you were able to practice on animal by yourself. This is one of the cool part. A lot of students who have taken this class are very excited and very happy with this part. And we also have animal disease model for the skin disease and tumor. So Dr. Travers, our chair, and also Dr. Hu will show you how to make an animal model for the skin disease and tumor by injecting certain agent into animal models. So this is all about this class. As you know, many of the lab, they also doing a lot of animal studies. When you want to investigate to determine a drug, if it's effective for a disease, usually you have to go through the animal study before go to the clinical trials. But this is a very useful technique for you to learn. And
Hello, I am Dr. David Ellis, and I am adjunct faculty at Wright State in the Department of Pharmacology and Toxicology, and I'm a research toxicologist with the Navy Medical Research Unit at Wright-Patterson Air Force Base. I teach Introduction to Cell Biology, PTX 6002, which is fully online and designed for you to complete on your own schedule. I also teach a online journal club, PTX 7002, which discusses pharmacogenomics, and it's also fully online and designed for you to complete on your own schedule. I hope that each of you has a wonderful experience, a positive experience at the Boonshoft School of Medicine and Wright State University, and I look forward to seeing each of you in my classes.
Hi everybody, this is Dr. Pierre from the Department of Pharmacology and Toxicology. First of all, welcome to Wright State University. Today, I would like to briefly introduce my research area that we have been doing and maybe we will be doing in the future. So my research are basic and translational project in the vascular disease area. It includes cerebrovascular disease with focus on the strokes, ischemic stroke and hemorrhagic stroke, and also the diabetes-related vascular complications, and stem cell therapy with focus on the endothelial progenitor cells, as well as a hot area recently in the microvesicle and the exosome. So the ischemic stroke is occlusion of a blood vessel supplying the blood to the brain or in the brain. So we have an animal model to induce ischemic stroke in the mouse by doing the middle cerebral artery occlusion. After the surgery, we can record the cerebral blood flow, and we can also do all sorts of immunofluorescence staining to measure the infarct value like the stroke size, and as well as angiogenesis. For the hemorrhagic stroke, is different from the ischemic stroke. Is a rupture of a blood vessel in the brain to cause bleeding in the brain and then leading to the neurological dysfunction. The animal model we are using in our lab is the microinjection of the collagenase to induce hemorrhagic stroke. With the microvesicle and exosomes, there are two different types of extracellular vesicles released from the cells. We are focusing on investigate their biomarker role in the vascular disease area as well as in diabetes and also the UVB-induced skin injury. We are also interested in their functions. They are not only a biomarker, but they also could be functional because they carry all sorts of molecules, including proteins, microRNAs, and messenger RNAs. So we are interested in to see the function of the endothelial progenitor cell release exosomes in the vascular disease area, such as stroke, also in the diabetic complications, as well as the UV radiation-induced skin injuries. This is our collaborative project with our chair, Dr. Travers, to see the role of the microparticle in the UVB induced skin injury. So currently, we have 2 master students in my lab. One of the students is going to defend this summer. Her project is actually in the role or effect of the exercise in the exosome release, as well as inflammation in the adipose tissue. The other student's project is on the endothelial progenitor cell release exosomes in protect the neurons from the hypoxia injury. So right now we are doing it actually because of the pandemic effect. So we are focusing on writing a review article together, then she will go back to lab and doing her project. But this is all about my research area, maybe not all, partially. If you have any questions, feel free to contact me. Thank you.
Hi, my name is
Too often we see people with advanced degrees in leadership roles without any training. A college degree alone does not give you the skills to work effectively with people. My leadership credentials: a 1.5-year meeting with an executive coach, a doctorate degree in organizational studies leadership track, Boonshoft School of Medicine Leadership Academy, FBI Leadership Academy, a postdoc at the VA in the Simulation Center training physicians and healthcare professionals. I have provided people in military, industry, academics, and government leadership workshops playing the same games we do in the classroom. This leads me to talk with you about my course, Leadership Theory and Application. The students are responsible for reading 2 books, Primal Leadership and Crucial Conversations. A weekly assignment consists of the student reflecting on the chapters they read and writing about how this lesson plays out in their own life experiences. The classroom portion of the class is where the fun happens. We meet 8 times over the semester and role play. The first meeting gives the students a chance to find out if they have any leadership skills and where they can improve. This is called 4, 5, 6 Power Platform. The next meetings include elevator speeches, meeting behaviors, verbal and nonverbal communication. They have practice giving people bad news, and a fair amount of time in the classroom is dedicated to writing and improving your curriculum vitae. The biggest complaint from outside the classroom is that we're having too much fun, laughing. And from the students in the class, they want more face-to-face meetings. Last spring, the students were not ready to have class over, so we continued to meet a few weeks into the summer. It's a 3-credit-hour class and may be your only chance to learn to be a great leader. Why would you want to miss such an opportunity? But wait, there's more. I'm also responsible for the Human Studies class, a must for any scientist interested in clinical work. It is a simple class that's packed full of goodness. Students go to the CITI, pronounced city, training site, and after a question-answer session, they are given a series of modules to read and are tested on. If they get an 80% or greater, a certificate is generated. This is a national website, and everyone in the country doing human studies must do training on this site. Only they don't get credit for it like you will. You will complete 5 modules and upload a copy of your certificates for the grade. You must also complete a Human Studies petition. The purpose of this assignment is to make you familiar with human studies, but if you want to submit your petition to the University IRB board, you should. Lastly, you must answer a few questions on the discussion board. As I said, simple class. Both of these classes give you new sections for your curriculum vitae, Our department cares about you and your career, not just you in the classroom. So you will find that many professors are often reminding you to add this or that to your CV. And this is why we offer classes like Human Studies, Leadership, Career Planning, GLP, Lab Management, and more. Thanks, and I will see you soon.
Hello everyone, my name is Dr. Ravi Sahu. I'm an assistant professor in the Department of Pharmacology and Toxicology, Boonshoft School of Medicine at Wright State University. My research has been focused on various aspects of cancer and cancer therapeutics. In particular, my lab has been interested in exploring the translational relevance of phospholipid-mediated-based signaling pathways. So the areas of translational research studies that we do in the lab are to define the role and mechanisms of environmental carcinogen, such as ultraviolet B radiation, various pollutants, as well as various therapeutic agents like radiation therapy, chemotherapeutic agents, targeted therapy, and immunotherapy responses. So and these projects are very significant because we all know that we have been exposed in our daily life either to environmental carcinogen or various pollutants. And the chronic exposure has been shown to be associated with various adverse effects. And also, one of the major challenges that the cancer researchers they are trying to address is how to increase the efficacy of cancer therapy, which is due to the effect of tumor resistance mechanism. And platelet activating factor pathway has been involved in these events. So what we have shown over time is that all these agents, they generate free radicals that can produce oxidized lipid that has platelet activating factor, PAF, and PAF-like activity. They then act through this G protein coupled PAF receptor, which is expressed on various cell types and mediate several acute and systemic effects. And we study their role in cancer progression and cancer therapy efficacy. So we use various research tools for our bench to bedside translational studies. We have a model system that either express or do not express this PAF receptor, and we then treat these various tumor cells with or without different agents, and then analyze their effects on measuring various biological parameters, including the generation of PAF agonists, microvesicle particle release, as well as their effects on various signaling pathways. We also use various mouse models, like knockout mouse model of the PAF receptor and also transgenic mouse to measure the immune responses. And what we basically take as a readout is that measuring tumor growth and also the efficacy of therapeutic agents. We also take advantage of the human studies to define their translational relevance, and for that we utilize various tumor tissues and blood and serum samples from pre and post chemotherapy treated cancer patients. And these various projects are ongoing in my lab, and we have also been exploring the effects of PAF receptor on microRNA. And these projects are being done in collaboration with faculty colleagues, including Dr. Jeffrey B. Travers. As far as my academic teaching goes, I've been involved in teaching effective scientific writing, part 1 and part 2, that's been designed for leader admin track students, and I teach various topics on cancer pharmacology and therapeutics. I've also been teaching thesis development workshop with another faculty colleague, Dr. Yon Zizou, and we teach the students how to design a working hypothesis, what research tools to be used, and how to interpret the research findings and overcome any flaws or limitations. I've also been teaching integrative pharmacology and toxicology, which is directed by Dr. Jibel, and I teach various cancer models. And then I also teach overview of animal research, which is being directed by Dr. Imli Dudley, And here I give a broad perspective of various mouse models that's being used for skin cancer research. So I hope you would be very interested in joining our department and also taking advantage of several courses that the department offered, and also taking advantage of our interesting research project. I have had 2 master students who are graduated this spring semester. So thank you very much, and if you have any questions, you can directly email me or check the faculty website.
Hi, I'm back. Your orientation is now over. How do you feel? Was it very painful? Have you decided on which track you want to take? Was there any special course that interested you? You know, I once had a student tell me the worst part of our curriculum is that we had too many classes that he was interested in taking and he could not take them all. I think that's a great problem. As I stated in the beginning, if you have any questions, please reach out to my team, and I cannot wait to meet all of you.